Hello everybody. Assessment of opportunities and challenges of Regina North Central Community is prepared by Group 6 members Arunama, Obi, Halima, Manisha and Rani. Community history and perceptions. North Central Community is one of the oldest and largest neighborhoods in Regina with a rich cultural and social history. The plan of development of this neighborhood started in 1883 for the employees of North Canadian Pacific Railways. However, with the migration of First Nations and Métis and the need of need of housing after World War II, other divisions and subdivisions were added to the neighborhood. In 1927, Pardy Young Stadium was built, which became the home of Rough Riders and renamed as Music Stadium in 2006. And in 1905, the first community school, which was Albert School, was built in the neighborhood. The neighborhood is a home for population. The neighborhood is home for 1,200 residents. Population is declining, however. There was a decline of 10.2% between 2001 and 2006. Younger cohort between the ages 0 to 9, 15 to 19, and 2024 make the largest proportion of the population in the neighborhood, and majority of the residents are from Aboriginal ancestries, including Métis and First Nations, and immigrants make a small proportion of the population. Physical environment. North Central Community has a unique environmental and well-organized physical infrastructure, which is necessary for an urban neighborhood. In the north and south, the borders are First Avenue and Saskatchewan Drive, aligned with Canadian National and Canadian Pacific Railways. On the east, the border is Broad Street, and on the west, Leuven Drive makes the border for the neighborhood. The grid system of the streets permit easy access between short distances. However, the permeability to north and west are limited due to rail tracks and busy Leuven Drive. The streets and sidewalks are fairly maintained, and there are several residential areas with houses and apartment buildings. Also, several other facilities, including schools, public library, and several businesses. Socio-economic environment. The average annual income in the North Central communities about $34,976, which is approximately half of the average household income in Regina. Majority of the residents are underemployed, and 46.8% of families are low income. Therefore, the larger proportion of the population rely on social services and have limited access to food and goods and services. 46% of the population are single parents with children and depend on support from social services. Transportation and safety. North Central Community is surrounded by major roadways with heavy traffic. Even the streets within the community are facilitating heavy truck routes. But several public transport routes serve the area from 5 o'clock in the morning to past midnight from Monday to Saturday, and 9 to 7 o'clock on Sundays. Accessibility to public transportation enables the residents to reach their destinations without the need for driving. However, the heavy traffic makes the neighborhood a little isolated and causes barrier effect. Safety is an ongoing issue in the North Central community, and the common contributing factors for safety are low lighting on the streets, poor visibility due to untrimmed trees and bushes, lack of street signs, damaged properties, and gang-related graffitis and activities. Many residents and visitors are concerned with these gang-related activities causing vandalizing and damage to their property and houses. Education. There are 6 community schools located in the North Central community, including Wascana School, Albert Community School, Kitchener Community School, Scott Colgate, which is a high school, Sacred Heart Community School is a Catholic school, and ENCO program, which is an adult learning program for those in need. Health and social services. Several social services and organizations, including Albert Scott Community Center, Commonweal, the Public Library, North Central Community Association, and North Central Family Center, offer a variety of cultural and recreational programs in the community, which promotes cultural identity, healthy lifestyle, and better connection among the residents. Also, among the health centers in the neighborhood, the major ones are Pasco Hospital, located on Disney Avenue. Four Direction Community Health Center also offers a lot of health services and educational programs for the residents. North Central Community Association Health Office is providing educational program, for example, about hypertension or diabetes, and also they have an affordable foot care program for the residents. There are several walk-in clinics and physician's office in the neighborhood, and Meadow Clinic across from the Pasco Hospital is open till midnight, and it's a walk-in clinic. Communication. North Central Community has a newspaper called Community Connection, which is a bi-monthly paper published by North Central Community Association. It promotes well-being, connection, engagement, and pride in the community, and many non-profit organizations and corporates are partnered with the newspaper. Recreation. North Central Community attracts many people from around the city with facilities they have, including Lawson Pool and Field House, Everest Place, Music Stadium, Albert Scott Center, and North Central Family Center. These facilities and organizations provide social, cultural, sport, educational, and recreational programs and activities. Policies and government. North Central Community is subject to all municipal, provincial, and federal government laws, and also North Central Community Association, which is a non-profit organization. It's a government body run by board of directors. It works toward enhancing the quality of community and with effective programs. We use secondary sources to collect data. However, we face so many challenges with these sources. For example, there was so many sources with contradicting information. So therefore primary data collection would have been a better way to collect data, and through interviews, surveys, participation in programs and events in the community. Community strength. Based on our assessment, we determined a couple of strengths in the community. One of the strengths in the community is proximity and access to facilities, including schools, recreational facilities, churches, and health centers. Also, access to public transportation enables the residents to participate in these programs without need to commute for long distances. Another strong point for the community is the increased population of younger cohorts. If these children are raised in the North Central community with decent education and a better opportunity, for example, with a decent place to live, grow, and where they can have good education and jobs, so the North Central community will have a better future than it's facing today. So it's a better future. Community challenges. One of the challenges faced by the community is poverty. So the community is really affected by poverty and its consequences. The McLean magazine in 2006 mentioned that its North Central community is one of among the poorest spots in urban Canada. Because the average household income is low, it's lower than average household income in Regina. Also, 46.8% of households in the North Central community are considered low income, and many single parents with children live in this area who have little access to necessities of life. As a result, 30,000 of residents depend on government assistance, and more than 36,000 requests are received by local food banks every month. Another challenge faced by the community is interconnected crime, drugs, and prostitution, which affects the neighborhood. However, although the crime is a citywide problem in Regina, it's more concentrated and more common in the North Central community, and it's increasing every year. So besides the safety issues with the residents and visitors in the neighborhood, there are several health issues related to crime, drug usage, and prostitution, such as increased rate of STDs like syphilis, chlamydia, HIV, and AIDS. There are negative and positive perceptions among the residents of the area. In an article published by University of Regina, several residents in the area was interviewed, and they had positive or negative perceptions. For example, Jasmine McDonald, who is a resident of North Central community, she moved from Saskatoon and bought a house in the neighborhood because of the cheaper price. However, she said that she didn't really feel comfortable and safe to walk by herself. On the other side, Michael Parker, Director of Community Services of North Central Community Association, mentioned that association is working alongside the Regina Police to make the neighborhood safe for everybody. Also, the Division of Regina Police location. Based on our assessment, our nursing diagnosis is poverty related to unemployment, underemployment, larger family sizes, and increased cost of living, as evidenced by lower income, increased number of families rely on social assistance. North Central community is affected greatly by poverty and its consequences. For example, in East North Central community, families live with income of $90 per month, which is way below the threshold, and there is an increased need for employment and social support. To address the issue of poverty, we made a plan, and with this plan we would involve social services, government funding, health professionals, schools, community centers, and residents themselves. So the social services would be involved to advocate for increased funding, subsidized housing, and extra health services like dental and prescription coverages. The social workers also can assess the individuals and families and assess them to evaluate their resources and access to financial support and local food banks. Education has a great role, so it will be helpful to have some employment counselors to arrange for employment trainings, assisting community members to enhance their level of performance or learn new skills. Simple steps like how to make resumes, look for a job, where to look for a job, or tips for job interviews would be taught to individuals in groups. Also, the community health nurse can educate families with the diet and how to get affordable food with cheaper price.